Afternoon, everyone, and welcome to the COVID-19 update for Friday, November the 20th. I want to kick us off by building on last Friday's conversation about housing stability. To remind you, Illinois launched the largest housing assistance program in the nation in response to the COVID-19 pandemic, dedicating over $300 million to help households pay their rent and their mortgages in this extraordinarily challenging time. Today, we've reached a new milestone. The Emergency Rental Assistance Program has approved nearly $200 million in rental assistance to sustain 40,000 Illinois renters and landlords during these extraordinary times. Because of this program, tens of thousands of families may have a more peaceful Thanksgiving knowing that their housing is secure. And as of this week, more than $40 million has been approved from our mortgage assistance program, on track to support 10,000 homeowners by the end of 2020. In fact, after meeting the needs of our mortgage owners, we have enough additional funding remaining to support an additional 10,000 renters and their landlords, bringing the total support for rent payment to well over $200 million by the end of this year. I'm grateful to the IHDA Executive Director, Kristen Faust, and her entire team for their dedication and commitment to stretching the reach of these funds to support even more Illinoisans in need. Of course, I wish all of these support amounts could be so much higher. Tens of thousands more people applied for assistance than we have the capacity to serve at the state level, as the nation faces a massive housing instability crisis due to this pandemic. I want to remind all Illinoisans who are struggling to pay their rent or their mortgage, whether or not you applied for this program. We have an eviction protection order in place for middle and lower income individuals and families that runs through at least December 12th. The form that renters need to complete for eviction protection can be found on www.ihda.org. That's ihda.org. Here in Illinois and across the country, renters, landlords, and homeowners are experiencing immense pain. And if this nation's largest state-developed assistance program, the one we have here, is hearing from more than twice as many people as we can actually help, well, that's a sign that we need serious action on a national scale. My administration will continue to call on the United States Senate to come to the bargaining table with a real willingness to address that pain, the pain of the families, businesses, landlords, renters, workers, states, cities, school teachers, healthcare workers, restaurant owners, and entrepreneurs. It's pain that transcends political party. Americans deserve more than this, and we need more than this. Today is the first formal day of our temporary Tier 3 mitigations. Remember, the core philosophy here is that if we all stay home as much as possible, if we all avoid the trips outside the house that we don't need to take right now, we can fight this recent surge and turn things around for our healthcare workers and hospital systems who are facing an increasingly dangerous situation across the state. And we can potentially pull back on these mitigations for everyone before the December holidays. I want to offer a reminder about who we're talking about when we say healthcare workers. These are real people, doctors and nurses and cafeteria workers and sanitation workers and other essential workers who never thought that they'd end up working double shifts on multiple days in the same week for weeks on end in the middle of the worst public health crisis in over a century. They too have families that they worry about. They too are exhausted. They come home at night or early in the morning and have to strip down and wash their clothes immediately to avoid spreading COVID to their families. They deserve our respect and our help. People like Betty Coonrod, an infection disease nurse at the Adams County Health Department. Betty works 80 hours a week, 7 days a week. She's exhausted, and yet Betty still finds a way to go above and beyond to counsel COVID patients in their time of need. Or Amy Marley, a communicable disease nurse and public health administrator with the Lawrence County Health Department. Amy spends every day running COVID tests, caring for patients, and reporting out numbers to the public. And she's been doing it for what seems like an endless number of months, somehow always with a positive attitude. And then there's Debbie Freiberg, a retired nurse who signed up with the Rock Island County Health Department to be a volunteer contact tracer way back in March. And she's been doing it nonstop ever since, logging nearly the same number of hours as full-time staff there. Debbie's colleagues say she's a rock star in their department, completely committed and always kind, working hard to educate people across the county on how to deal with a positive diagnosis. When Dr. Ezike and I get up here and we ask you to wear your mask, avoid gatherings, and to follow the public health mitigations, we're not asking you to do it just for us. We're asking you to do it for Betty and for Amy and for Debbie and the thousands more like them across the state who are doing everything they can to keep the rest of us safe. When we get to the other side of this pandemic, let's make sure that we did everything in our power to support their efforts and to bring as many of our neighbors as possible over the finish line. Thank you, and with that, I'd like to turn it over to Dr. Ngozi Ezike. Doctor.
Thank you, Governor, and happy Friday. I want to take a minute to reflect on the evolution of this pandemic. Not the science or the numbers, but how we socially responded since the first case of Illinois, the first case here in Illinois that was reported way back January 24th, 2020. 10 months ago, we were all waiting to see what would happen after that first initial case. Would we see more cases, or would it be just that one from the individual who had recently traveled? Then we saw the second case here in Illinois, and that was the first person-to-person transmission in the United States, and the alarm started to sound and quickly grew as additional cases were reported day after day. Healthcare workers and public health professionals worked around the clock to learn as much as possible and share it with the public as quickly as possible. And during this fretful time, we came together to support one another. And we reached out to others, and we called, and we checked on each other's welfare. We didn't look for who we could blame, but offered support to one another instead. When states across the United States and even some countries around the world began the stay-at-home orders, we all wanted to do whatever we could to prevent additional sickness and deaths. And it worked. And the number of cases decreased, as well as the number of hospitalizations, as well as the number of deaths. They decreased dramatically. But as we've seen our numbers trend in the wrong direction now, unfortunately, that support that we initially saw has faded, and in some cases is absent. Just as real as the virus is, so is the COVID fatigue that is accompanying it. And we're all tired of this virus, and we're tired of staying home, and we're tired of denying ourselves our common pleasures. But instead of blaming the virus for these concessions that we've been asked to make, we're looking to blame one another. And so I just want to urge people to be kind. Doctors, nurses, respiratory therapists, public health professionals, you heard about Miss Betty and Miss Amy and Miss Debbie. All these people and so many others continue to work around the clock, and they're continuing to try to prevent additional illnesses. There are absolutely zero easy answers. There's no simple equation that says if you do X, then Y gets to happen. There's still many unknowns, there are many variables, and so there's no solution that's 100% effective, especially when it depends on every other member of the community to buy into the plan. For every person who is screaming that they have to have in-school learning, you have others who are adamantly against it. For every person who wants to have dinner inside of their favorite restaurant, there are those who are worried about their own personal safety and their lives. None of us has a crystal ball, and while it's often said that hindsight is 20/20, we are still in the year 2020, and you and I, all of us, can't wait to put this year 2020 in the rearview mirror. But until then, let's make decisions with the information, with what we can see right now. I'd ask for all of us to have patience and compassion for those with whom we may disagree, and to understand that this is an extremely difficult time for everyone. Nobody is getting through this unscathed. I think Dr. Singh said it very well yesterday, that this is a traumatizing mass casualty experience for all of us. Today, we are reporting 13,012 new cases of COVID-19 for a total of 634,395 cases in Illinois. Sadly, we're reporting an additional 126 lives lost, for a total of 11,304 total lives lost to this deadly virus. Overnight, 6,111 people were in the hospital with COVID-19, and of those, 1,196 were in the ICU, and 604 were on ventilators. In the past 24 hours, more than 116,000 tests have been reported for over 9.5 million tests thus far in Illinois. As we head into the weekend, I encourage each of you, offer kindness and support to your fellow neighbor. We all desperately need it. And of course, we also need you to wear your mask, and we need you to keep your distance, and we need you to get your flu shot, and we need you to plan a very small, household-only, safe Thanksgiving. Thank you.